Hey, welcome to Physio Advice. I'm Chris, and today we're talking about how to fix gluteus minimus dysfunction. We're going to be talking about a test that you can do to see if you have dysfunction, ways to do trigger point release, as well as some strengthening exercises that you can do. Gluteus minimus is the smaller glute muscle. If you feel for the hard bump at the side of your hip, it's just above that. It's about the size of your fist, and trigger points here will refer pain that mimics sciatica. So you get pain that starts in your buttock and travels down the side of your leg into your outer calf. So how can you check if you have dysfunction? Well, you can check the Trendelenburg sign. You're gonna stand on one leg. You should be able to stay in a nice upright position. A positive sign would be if your pelvis drops. Or you might compensate by leaning over the supporting leg. If you have any of these positive signs, it indicates that you have weakness in the outer hip muscles, specifically your gluteus minimus muscle. So what are some things that we can do to treat this dysfunction? One of them is trigger point release. So what you're gonna do is take a lacrosse ball and feel for the hard bump at the side of your hip. Remember, our gluteus minimus muscle is about a fist-sized muscle just above that bone. So you're gonna place the ball right there and compress it against the wall. You're gonna roll forward and backward, up and down, until you find a trigger point, so a tender area. You might find an active trigger point, which is where the pain radiates down the leg. You're gonna hold this position for about a minute, and you should feel that the muscle starts to relax. Another way to perform trigger point release is using a foam roller. So you're gonna sit on the foam roller and cross your affected leg over the other leg. You're gonna slightly lean to the side and roll your glutes forward and backwards. You're gonna do this similar to the lacrosse ball technique and perform it for about a minute. Now strengthening. If you failed the Trendelenburg test from earlier, you definitely need to be doing some strengthening of your outer hip. So we're gonna start with a single leg bridge. You're gonna focus on squeezing your glutes and driving your hips upwards. You wanna repeat 3 sets of 10 repetitions. Next, we're gonna do a wall push. Stand on your affected leg and bend the other knee and push it into the wall. You're gonna resist as if you're pushing your knees apart. Hold this pressure for 10 seconds and repeat 10 times. Lastly is a single leg squat. Standing on one leg, you're gonna squat down, repeating 3 sets of 10. Well, there you have it. Hopefully you've learned about gluteus minimus dysfunction and how you can fix it. Make sure you like and subscribe if you haven't already, and thanks for watching.